I'm board-certified New York City plastic surgeon Dr. Darren Smith, and this is Plastic Surgery Before and After, your source for the real deal about plastic surgery procedures, news about trends in aesthetic medicine, and candid sessions with industry insiders. We hope you enjoy today's episode. How can I prepare for my plastic surgery procedure? Plastic surgery procedures in general are safe, and you should have fairly smooth sailing through the entire process, assuming you do your homework and choose a board-certified plastic surgeon that is experienced in performing the procedure that you are interested in having done. And we have some earlier episodes on the best way to go about doing this. So the first step in making sure that you have a rewarding and easy plastic surgery process is making sure that you choose an excellent plastic surgeon that is right for you. But we're going to go ahead and assume that this step has been completed because we kind of went through how to do that in a couple earlier episodes, as I mentioned. And we're going to start off with talking about how you can set yourself up to do well during surgery, and then we'll move into the best way to prepare for a smooth post-operative course. This advice is really intended to be general and not applied to any specific case, as every procedure is different and every patient is different. So go ahead and absolutely listen to the advice of your surgeon, but this is just intended to provide some context when you're thinking about things on your own. So before you decide to have a plastic surgery procedure, as I mentioned, these do tend to go very, very well. They tend to be very safe, but they are real surgery, so you do need to make sure that you are set up and optimized to have the best result possible. And some basic things to do is to quit smoking approximately 4 weeks before most procedures, because smoking can, one, make your anesthesia experience less safe and less comfortable, and it can also cause major problems with wound healing and can even cause tissue loss, because the products in cigarettes and other analogous devices like jewels can cause the microcirculation, the small blood vessels, to contract, and this constricts blood flow to tissues, which is essential for tissue survival and optimal healing. So definitely make sure smoking is not part of your routine for at least 4 weeks before most plastic surgery procedures. It's also important to make sure that any medical conditions that you have are optimized and treated so that you are set up for a safe surgical experience. Remember, cosmetic surgery is elective, so if there is an ongoing health concern, a board-certified plastic surgeon is not going to perform a surgical procedure that could potentially put your health at risk. It's also important to make sure that your nutrition is optimized. You want to have good protein stores and be in good general shape when you are going to go through a plastic surgery procedure. And this also goes for physical fitness. It's important to make sure that your body is well conditioned before undergoing one of these procedures to, again, make sure that you're set up for a great result and a comfortable recovery. Plastic surgery can also be on the expensive side, so it's important to make sure that your finances are in order and that this is the right time in your life for you to be having aesthetic plastic surgery. So once you have consulted with your surgeon and come up with a surgical plan, and you have followed all of his or her preoperative advice to make sure that your procedure goes excellently, it's a great idea to start thinking about how to make your post-operative experience as easy as possible. And this really varies significantly by procedure, but it generally means setting up your recovery space such that if you need to be taking pressure off of a certain part of your body, like after a Brazilian buttock lift, this is a very common concern. We need to often offload the pressure from the buttocks so the fat graft can survive. In the case of an abdominoplasty, you want to set yourself up so that when you are sitting down or lying down, your waist is bent so that you're not putting tension on your abdominoplasty incision. And these are just a couple examples, but there are many more that will come up in the planning and discussions that you have with your plastic surgeon. It's also important to line up any help you might need after your surgical procedure. For example, I make sure that all of my patients that are having facelifts and abdominoplasties go home with a registered nurse experienced in caring for postoperative patients to make the beginning of their recovery a smooth and safe experience. Now, a lot of procedures certainly don't require an at-home nurse for recovery, but it is a good idea to make sure that you have a friend or a loved one on hand to help you out, especially in the beginning while you're getting your bearings as you're adjusting to the recovery process. It's also important to plan on your work schedule and make sure that the timing is good from that perspective to have an aesthetic surgery procedure with the necessary recovery time included. So hopefully these tips are useful as you start to think about what goes into having your plastic surgery procedure. And I invite you to reach out and ask more questions and join the conversation at www.askdrsmith.nyc. That's www.askdrsmith.nyc. And that's a great Facebook group that I moderate and I personally participate in, and we'd love to see you there. Thanks for listening, and don't forget to subscribe, share the show, and head over to DarrenSmithMD.com for more real-world plastic surgery talk.